My name is Dr. Heather Peters. I am an associate professor with the University of Northern British Columbia. UNBC, the main campus is out of Prince George, but we deliver the Bachelor of Social Work degree in 4 other communities, and Quesnel is one of those. So I'm based in Quesnel full-time, and I've been here since 2001, I believe. I think it's important to know that Canada started developing housing programs to help people who were having trouble affording housing back in the 1960s. They actually started earlier than that, but it was hit and miss. So, for example, after World War I and World War II, they helped people who were war veterans who needed assistance. That grew in the 1960s to programs, social housing, subsidized housing for anybody who was low income. And Canada has had huge experience in doing that. We have great expertise. Our programs were world renowned in the 1960s and 70s. And then in the 1980s, Canada, along with the rest of other developed countries, the US, the UK, started slashing social programs. And in slashing social programs, homelessness started to grow. So people always talk about, why do we have a homeless problem? And they start listing, it's because of this, one thing, because residential institutions for people who had mental illnesses, because they closed, that's why. Well, that's not totally why. That might be a very small piece of it. But the reality is that we used to have social programs and social housing that ensured that everybody could have a place to live. We've done it once before already in Canada's history. And in the 1980s, we cut those programs. And they were slashed through the 80s and the 90s. They were slashed by both Conservative and Liberal governments. And we ended up in a place where it was ad hoc, piecemeal programs that were... Some provinces chose to keep doing housing programs. Most provinces didn't, because the federal government had dropped their responsibilities. So since then, our levels of homelessness have been increasing dramatically. At the same time, our costs for housing and costs to live in major cities across Canada, but even in smaller areas, has also grown exponentially. So social programs are cut. Income assistance programs, not only income assistance as we know it as welfare, but various programs have also been cut. And so people have less money to spend on housing. Minimum wage has essentially fallen, and average incomes in Canada have fallen over the last 30 or 40 years. And at the same time, house costs and land costs have risen. And so we've ended up in a situation where we've structurally created homelessness by not addressing those issues in the first place. The bottom line that I tell students in my homelessness course is that people are homeless because of 2 things that are flip sides of the same coin. People are homeless, number 1, because their incomes are so low they can't afford housing. And number 2, because the housing that's out there is really expensive and there isn't enough affordable housing. Those are the reasons. The reasons for homelessness are how we structure our society, and that we don't ensure that people have an income that allows them to buy food and shelter, and that we've structured our society to drop most of our housing programs over the last 30 years, 40 years. Seasons House has many roles, and I think most people in the community assume that Seasons House, just provides shelter beds for people who are homeless. But Seasons House has a way bigger role than that. Seasons House, the shelter beds are really important and significantly underfunded by BC Housing. They come nowhere close to matching what the actual need is. But Seasons House does so many other things as well, from transition beds, support recovery beds for people who are going into or out of substance use treatment, being an advocate for people in the community who really are the people who have the biggest needs and who are the most marginalized and ignored. Seasons House becomes a voice for those people. Without Seasons House, those people would be rendered invisible by the rest of society, and they would be ignored. And Seasons House keeps reminding the rest of us as community members that we need to pay attention to everybody and that all of our citizens should have access to having their needs met. Fear and stigma go hand in hand. Stigma develops in part because there's a group of people who are afraid of other people. And I talk to my students in class about that concept of othering, which means as long as it's not us, then we can say it's other, and then we start developing a whole set of stories and narratives around who that other is. And we do that with people who are homeless, and we say they're other, and then people who are afraid of them start coming up with reasons why it's not my fear that's the problem, it's that person that's the problem, or that group of people. That I try to place social work students at Seasons House as much as possible, because simply being there and meeting people helps do a lot to make those fears and that stigma go away. And I don't know how we do that with the average person in the community who's not going to be doing a practicum placement, but I do think that there's an element of them being able to, I guess, to see and meet people. And maybe that's through open houses at Seasons House. Maybe that's through things like videos that you can bring people who are homeless to them to actually realize that that they're human beings who are struggling and who aren't actually scary other beings. People usually buy into a whole bunch of myths around why people are homeless, and those myths are very much focused on the individual instead of looking at the structural things. And so they say that people are homeless because they are addicted, because they have substance use disorders. The reality is that some people who are homeless are struggling with substances, but they aren't necessarily homeless because of their struggles with addictions. Oftentimes they become homeless, and using substances becomes a way of coping with an incredibly difficult situation. Sometimes when people become homeless, they face issues of trauma. They are assaulted, they are treated poorly, they're stigmatized. And when you start feeling really bad about yourself because of how others are treating you, you use something. So having a substance use disorder does not actually, in fact, cause homelessness. You can have, and we know this because there are lots of middle class and upper middle class people who have substance use issues who are doing just fine and are not homeless. Sometimes they hang on to jobs, sometimes they don't, but they have an income from whatever sources that allows them to keep their homes. They still have addictions, but we don't see them because they're behind closed doors. Mental illnesses don't cause homelessness either. If we had affordable housing and support programs for people who are struggling with mental health issues, there's no need for those people to be homeless either. And likewise, sometimes a mental health issue manifests while people are housed and they become homeless later. But again, they become homeless later because they can't afford the housing that's there and there's no supports to help them stay in housing. But they can also suffer mental health issues because of the trauma they faced while being homeless. Other myths include that people who are homeless are criminals. I live 15 or 20 minutes out of town, and one of the comments on Facebook at one point in time was that there was somebody driving around in a big pickup truck looking to break into homes, and it must be people who are homeless. Well, I have bad news. People who are homeless don't drive around in big trucks. They don't own big trucks. So are there some people who are homeless who are committing crimes? Absolutely. Are there middle-class people who are committing crimes? Absolutely. The crime that exists in any given community is not because of people who are homeless. There are other factors that are involved in that. And for people who are homeless and who are engaged in criminal activity, most of the time the criminal activity is so that they can survive. They're looking to afford food and shelter. And if they've experienced trauma and they have a substance use disorder, maybe they're looking to be able to pay for substances. And none of those are reasons for not providing shelter. If shelter and food were provided, they wouldn't need to engage in criminal activity. Ultimately, we all have the same goals for our community. None of us want to live in a community that is unsafe. None of us want to live in a community where there is substance use happening in public locations. None of us want to live in a community that has people who are sleeping on the streets because they have nowhere to go. Sometimes as a community, we just have different thoughts on how to address those. And I do think we need to talk to each other. I think that's probably one of the key starting points. There will always be some people for whom we will never change their minds. But we need to at least talk to each other and try to come to some consensus on how do we find places for people to live then if they don't have places to live. I don't think social media is the place to do that. I think social media is really important for doing some awareness raising things and letting people know that, we exist and there are people who exist who see things differently than maybe the vocal minority does. But I don't think we change people's minds on social media so much. I think we actually need to talk to each other, which is why we often need to talk to our neighbors. So as individuals, we just need to talk to people we know to help share some of that information on what works and what doesn't work and what the issues really are. And sometimes we need to come together in groups. I don't think it's Seasons House responsibility to do all of that, though. Seasons House is providing a really valuable service in our community to people who are homeless. I think it's the rest of us who need to figure out how to talk together. I think there's lots of things the community can do. There are always those people who say, not in my backyard, and we don't want it, and who buy into all of those myths that just aren't true about homeless people, that homeless people are, creating all sorts of problems. They're not actually. Homeless people are facing all sorts of problems in their lives, and they need those supports. So the rest of us can support Seasons House in a variety of ways. I think it's important that we pay attention to what they are doing and who they're working with, and that we do everything from showing up at those public meetings where there might be people who disagree, so that the rest of us are also there being the voice of this is why we need them, even to being on social media and clicking like and making the positive statements, all of those things and everything in between. We also, as citizens of Quesnel, should be lobbying various levels of government to improve services to marginalized populations, particularly to people who are at risk of homelessness or who are homeless. And we should be a part of a larger community that says, absolutely, Seasons House is doing good work and we need to support Seasons House and we need to advocate for other programs and services as well. Ultimately, the leaders in our communities should be the ones who are sharing information that's accurate and who are being a mediating force. And if we have leaders in the community that aren't doing that, which sadly I think is the case right now in Quesnel, it actually makes things worse instead of better.